First, thank you for coming to this press conference. Our vaccination program is making steady progress. As of yesterday, more than 1.1 million doses of COVID-19 vaccines have been administered. Close to 800,000 individuals have received at least one dose of the vaccine. Among them, more than 300,000 individuals have received their second dose and completed the full vaccination regimen. We have also made good progress in inoculating our seniors. As of 23rd March, more than 55% of seniors 60 years and above have received their vaccination or made appointments to do so. We encourage seniors who have not yet done so to come forward as soon as possible to register for their vaccinations. Seniors who need help in booking their appointment online can visit any of our PA's CCs, community clubs, and community centers island-wide, and there will be staff and volunteers there to help them. We currently have 31 vaccination centers that are up and running, on top of the 20 polyclinics and 22 PHPC private clinics that are also in operation. By about middle of April, there will be a total of 40 vaccination centers island-wide. Like our community care facilities, which we rapidly stood up earlier on during the pandemic, the setting up of these vaccination centers is a whole-of-society effort that involves the close collaboration of both public and private healthcare partners and government agencies like People's Association. I want to take this opportunity to thank our partners for working with us in this national effort. I would also like to apologize for any hiccups or inconvenience to our residents during these initial stages as we work to iron out some of the teething problems. On average, we administered around 40,000 doses a day last week, including second doses. If vaccine supplies continue to arrive on schedule, we will have enough vaccines for all Singaporeans and long-term residents by the third quarter of this year, and we will be able to complete our vaccination program by the end of this year. With the vaccination for the prioritized groups well underway, we are now ready to expand the vaccination program to younger age groups in the population. We will commence vaccination for persons aged 45 to 59 years old. We invite those in this age group to register your interest online for vaccination from today. We seek everyone's patience and support as we expand our vaccination efforts steadily. A key factor in how fast we vaccinate our population is the supply of vaccines. We will continue to monitor our supplies closely, but we expect global supplies to remain tight and supply chains may be disrupted from time to time, which will affect our pace of vaccination. And I encourage everyone who is eligible to get vaccinated when your turn comes, to protect yourselves and fellow Singaporeans from infection. As we roll out vaccination to a larger proportion of the population, the multi-ministry task force is also looking at how we can allow more activities to resume for inoculated individuals. Let me give an example. From 24th April, we will allow some events, such as live performances at designated venues, to be conducted with a larger scale of up to 750 pax instead of 250 currently. But pre-event testing will be required. Individuals who have completed the full vaccination regimen at least 2 weeks prior to the event can participate in such events without the need for pre-event testing. The task force will continue to explore broader guidelines on what vaccinated persons can do as we make further progress on vaccination. Even as we progress with further community opening, we must remember that adhering to the safe management measures remains key to ensuring safe opening. This is true even for those who are vaccinated. As more and more of us get vaccinated, we can look forward to further reopening. So let us keep our fight in the meantime and remain vigilant and socially responsible. Together, we can continue to keep one another safe. Let me say a few words in Mandarin. 我们的接种冠病疫苗计划进展稳健。截至昨天，我们共注射了110万剂疫苗， 约80万人已经接种了首剂疫苗，当中大约31万人已经完成了2剂疫苗。年长者接种疫苗也取得良好的进展，超过半数年满60岁的年长者已经接种了疫苗，或者已经预约要接种了。我们鼓励那些还没有接种的年长者尽快预约。如果需要有人帮忙上网预约的年长者，可以到全国任何一间民众联络所或者是民众俱乐部，那里的工作人员和义工可以帮忙大家来预约。目前我们有31所接种中心投入运作，另外也有20间综合诊疗所以及22间私人诊疗所提供接种疫苗服务。大概到了4月中，接种中心将增加到40所。这次的接种行动动员了全国上下，包括公共和私人医疗单位以及政府机构如人民协会等，紧密的合作，一同努力的来执行。初期开始运作时，或许会遇到一些操作上的问题，可能为一些居民带来不便，对此我们深感抱歉，还希望大家多多包涵。我也要在这里感谢所有与我们合作推动这个全国行动的伙伴。我们上个星期平均每天注射的疫苗达到大约4万剂，包括部分人的第2剂疫苗。如果疫苗供应继续如期地运抵我国，我们到了今年第3季，会有足够的疫苗为所有的国人和长期居民来接种，并且渴望在今年底之前完成接种的行动。优先接种群体目前的接种进展顺利，我们因此准备开始为更年轻的群体，那一些年龄介于45岁到59岁的人来提供接种。我们邀请这个年龄层有意接种的群众呢，从今天开始可以上网登记，到时我们会陆续的发出短信，让你能够预约接种。希望大家能够耐心的继续支持我们的接种行动。疫苗的供应是关键因素，我们会继续密切的留意疫苗的供应，但我们也要有心理准备，因为全球的供应继续吃紧，供应链也会时不时受到影响，这些都会影响我们接种的进度。我鼓励所有合格的人，在轮到你们的时候，尽早去接种疫苗，保护自己，也保护其他的国人，免受冠病病毒的感染。随着我们逐步让更多人有机会接种疫苗，跨部门工作小组也探讨了如何让已经接种的人可以参加更多的活动。举个例子，从4月24号开始，更大型的活动将允许进行，比如在指定的场所所进行的现场演出，人数顶限会从目前的250人上调到750人，但前提是出席者必须在活动前进行冠病检测，而那一些在活动举办前已经完成所需接种量至少2个星期的人，可以不用接受活动前的检测。就算我们继续进一步的开放我们的社区，大家遵守相关的安全管理措施依然是至关重要的。已经接种疫苗的人也应如此。随着越来越多人接种疫苗，我们可以期待接着下来可以进一步的开放，所以大家这段期间还是要继续对抗疫情，保持警惕，也要负起社会责任，让我们大家继续一同努力，保障彼此的安全。谢谢。And now I'd like to invite my Director of Medical Services, Professor Kenneth Mark, to give an update on the status of the pandemic.
Thank you very much, Minister. As of today, the 24th of March, 12 noon, the Ministry of Health had preliminarily confirmed that there were 15 imported cases that had been detected to have COVID-19 infection. These were all in travelers who had been placed on stay-home notice since their arrival in Singapore. We have not seen any new cases of locally transmitted COVID-19 infection. In fact, we've not reported any new cases of COVID-19 infection in the community since the 12th of March. And we continue to be vigilant, looking for any such local cases as we continue testing for travelers coming into Singapore. We're still working through the details of these cases and will provide further information through our update later this evening.
Good evening. It's been more than a month since we had our Chinese New Year break. At that time, we were concerned that with the increase in interactions and activities during the Chinese New Year period, there might be an increase in local transmission after that. But I think, fortunately, since then, we've been able to keep the infection under control, and we have made good progress in vaccination, as you heard from Minister Gan just now. So I want to thank everyone in Singapore for their cooperation. With the good progress we have made so far, we are able to now take some steps in easing some of our measures. For measures in the workplace, the tripartite partners have been discussing, and we will make the following changes with effect from 5th of April. First, we will shift to a more flexible and hybrid way of working. And that means we will allow more employees who are presently working from home to be able to go back to the workplace. In particular, 75% of the employees who are presently able to work from home will henceforth be able to go back to the workplace at any time. So that's 75%. It's an increase from the present 50%. We will no longer mandate the requirement for split teams, but we will strongly encourage employers to still stagger their start times and implement flexible working hours. And of course, employers must continue to implement all prevailing safe management measures. Next, we will also be able to have larger gatherings, particularly with pre-event testing. And so these new parameters will start to take effect from the 24th of April, including for the following settings. For solemnizations, we will allow an increase in the limits from 100 persons to 250 persons, with pre-event testing for the wedding couple. For wedding receptions, we will increase the limit from the present 100 people to 250 people, with pre-event testing for everyone attending. And for live performances, business events, sports events involving spectators, we will increase the limits from 250 to 750 people, with pre-event testing for everyone who is attending. And as you heard from Minister Gan just now, vaccinated individuals need not be subject to the pre-event testing. We are, as highlighted just now too, considering broader guidelines for vaccinated persons, beyond just this exemption from pre-event testing. I think the evidence around the world shows that the vaccination can help not just to protect yourself, but also reduce transmission risk. So we will look at what the guidelines are for vaccinated persons with regard to social activities, interactions, as well as for travel. It's still work in progress. We are not able to share anything at this present time, but clearly the direction is towards more flexibilities for those who are vaccinated. So we would strongly encourage everyone in Singapore to make an appointment for the vaccine when you have the opportunity to do so. Finally, we just want to remind everyone that we should continue to be mentally prepared, that while we have been able to keep things under control up to now, we must be mentally ready for any new challenges down the road. And we have learned over the past year that with this virus, there are many new unpredictable threats that can emerge. For example, we may have disruptions in the supplies of our vaccines. We may have new strains, more new strains emerging that are more infectious, more virulent. And while we do our very best to test, to trace, to prevent clusters from forming, you never know if something slips through and new cases emerge or new clusters emerge. And if some of these cases or clusters stem from some of the more infectious strains, then potentially we will have to do a lot of hard work to stem out the clusters. And it will be back into a situation that is going to be very challenging all over again. So we really should look forward with caution and continue to move forward in a controlled, deliberate, and steady manner. Don't get too excited that things are under control and then we can quickly open up everything. I think that would be rash, and that can easily undo all the good things that we have achieved so far. But we move forward in a controlled, steady manner, looking at data, looking at evidence every step of the way, and adjusting our measures wherever necessary to ensure that we can continue to keep things under control and to keep everyone in Singapore safe. Thank you.
I will now welcome questions from the media.
Thank you, Ministers and DMS. We will now begin the Q&A segment. Dear members of the media, if you would like to ask a question, please use the raise hand function. Please be reminded to keep to one question only. May we have the first question from Ray from ST?
Thank you, Minister. Can I just ask, with the relaxation for the various live events as well as workplaces, there's been no mention of relaxation for private social gatherings for groups larger than 8 persons. So can I just ask, are there any plans to expand this cap? And if not, why is the government reluctant to do so at this time? Thank you.
The 8%. Sorry? The 8% limit.
Oh, I see. I'm trying to, just to make sure we get the question correct, why are we not moving the limit on 8 persons? Is that right?
That's right. Why is the government reluctant to do so at this point in time?
Well, as I said, we continue to review all our measures, and as I highlighted just now, I think it's better that we move in a controlled, deliberate, and steady manner rather than to move too quickly to relax measures, and when you do so, you find that there is a risk that clusters form, and particularly if the clusters are stemming from more infectious strains of the virus, they can spread very quickly, and then when that happens, you have to move in again with additional restrictions. This is not something hypothetical. We've seen this happening in many countries. So rather than take an approach where we are quite relaxed about the measures and just lift and liberalize measures too quickly, we are looking at it in a controlled manner, reviewing every single move we make, watching the outcomes of these moves, making sure that the situation remains stable, continuing with our vaccination program and making sure that that proceeds smoothly, and then as we take one step, things are okay, we take another step, and then we take another step. So that will be the approach we take. That has been the approach we've taken throughout the past year, and that will continue to be the approach we take this year, relying heavily on data and evidence as we make each move.
Perhaps I could add that one of the key reasons is because unlike the other measures that we have mentioned today, this social gathering limit of 8% is actually quite a broad-based measure. Any adjustment to this number actually has a very broad-based impact on the whole social interaction, and therefore the risk of transmission goes up significantly. But I assure you that we are looking at this constantly. We review this measure quite regularly, and when we are confident that it will not create problems with transmission, we will do the necessary adjustment, and we will make the appropriate announcement at the right time.
Thank you, Ministers. Could we have the next question from Tao Pao, please?
Good evening, Ministers and DMS. Sungit from Zabao here. We understand that the government is in talks with countries in the region on the mutual recognition of vaccination certs. But given the various types of vaccines used by other countries, I'm wondering if Singapore would only accept evidence of vaccines that are already approved within our borders.
Well, we continue the discussions with various countries, so that process is an ongoing one. there are indeed different vaccinations being used, and we know that the different vaccines have different levels of effectiveness. But I think it's also important to look at the considerations for travel in different perspectives. First, regardless of the type of vaccine that's being used in any country, I think the vaccines do have an impact in helping to reduce the incidence and the spread of the virus. And to the extent that that happens, then the country progressively is able to keep its infection under control, and in time to come, it will become a low-risk country. And you know that in our framework for travel, we have a categorization based on risk. Lower risk, we allow for travel without any SHN, stay-home notice. Higher risk, then you have a stay-home notice. So, firstly, if the vaccines help to reduce the incidence rates in those countries, then they may move from a higher risk country to a lower risk country, and then mutual travel or travel without SHN may already be possible. That's one. Number two, regardless of the types of vaccines that are used in different countries, I think we will want to also look at some form of testing of the individuals, and that might include antibody tests to ascertain that the person has been vaccinated but also has the antibody response to the vaccine. So that's another way that we can determine that vaccination has been effective and has brought about the immune response from the individual. And so these are all the different considerations that we are looking at when it comes to travel. It's not just looking at the vaccine alone, but it's looking at broader considerations, including the overall situation in the country and the possibilities of additional tests that can be administered. And we will continue those conversations with different countries in working out the best way to facilitate travel in a safe manner.
Thank you. Can we have the next question from Deborah from CNA, please?
Hi, good evening, ministers. I actually have two questions. The first one would be how fast the vaccine is rolled out depends on supply, as you mentioned. But in the meantime, how would you determine the level of immunity in the population? Secondly, so we've just seen that defective packaging affected a batch of Pfizer vials in Hong Kong. So what kind of contingencies or safeguards does Singapore have to deal with these kind of issues? Thank you.
What was the first? Sorry, what's the first question?
The first question is, so the vaccine rollout is dependent on the supply, right? But in the meantime, how will you determine the level of immunity in the population?
Oh, the immunity in the population. We will first look at the number of people that have been vaccinated. This is still early days. Our focus currently is still on the frontline workers, the healthcare workers, and the seniors. Now we are taking the next step, moving towards a younger population. And this is a huge population, about 1 million of them. So we hope that as we progress further, then as more and more people get vaccinated, then the overall immunity among the population will go up. But we also have to bear in mind that even if you are vaccinated, it's not a 100% guarantee. So it's still important for us to continue to practice safe distancing measures. And I ask the DMS to talk about the specific vaccine effectiveness and also the incident in Hong Kong.
Thank you very much, Minister. In fact, we are looking at the issue of immunity, but perhaps not in the same way that you asked that question. In terms of looking at whether or not the vaccines are effective and whether or not it gives rise to a significant amount of immune protection in the population, the best way of really looking at it is real-world evidence in countries where they've had a high incidence of infection. Then with a vaccination program that is directed at providing as many of their population to be safely protected through vaccination, then seeing those numbers come down, that is in fact very strong evidence that the vaccines work. And we're starting to see that evidence coming out from countries which have had mass vaccination campaigns, including Israel, the United Kingdom. And from that perspective, we have confidence that the same protection will arise in our population as we encourage more people to get themselves vaccinated. But it will not be easy for us to demonstrate this by looking simply at a change in incidence level of infection in our community, simply because we already, at this point in time, have an extremely low incidence of our community-based infection. Earlier, we had mentioned that we have not seen any community cases in the last 12 days. So in that sense, when you are at this sort of incidence now, you can't demonstrate that much better in the population. There's no requirement for the population to get themselves tested after vaccination to determine that they have the relevant antibodies. But there will be selected cases where sometimes we might carry out serological investigations, testing for antibodies in very specific contexts. For example, if they are now symptomatic with some signs and symptoms suggestive of a respiratory infection, and as part of our investigations, even though they are vaccinated, we may test them to assess whether they in fact got infected despite being vaccinated, or whether or not this was in fact some other infection, not COVID-19 at all. And in the course of doing this, we might assess their degree of immune protection after vaccination, but no routine requirement for tests to be done otherwise. Now, I understand that there were some concerns about a particular batch of vaccines arriving in Hong Kong. And to assure members of the public as well as the media, we do checks for every shipment of vaccines that come to Singapore as well. We do it for a variety of reasons, one of which is to make sure that the ultra cold chain by which the existing vaccines that we have, the Pfizer and Moderna vaccines, they require to be stored all the way from the point of manufacture through the transport and into storage in Singapore. They have to be kept within a very tight temperature range, and we monitor that to make sure that there are no temperature excursions, nothing to compromise the condition of the vaccines that arrive. In settings where there might have been some minor variation in the temperature settings just towards the extremes of the acceptable range, we have quarantined those stock pending further investigations jointly with the manufacturer. And in each setting when we have seen that, we've actually been assured that the vaccines still remain of high quality and good for use. And we've not therefore had any problems with the vaccine shipments to Singapore to date. We continue to be vigilant, and we will continue to make sure that the vaccines that arrive are safe and suitable for use in Singaporeans.
Thank you, Minister and DMS. Could we please have the next question from Reuters?
Hi, ministers. I would like to ask, do you expect any disruption, or if there's any disruption in vaccine supplies for Singapore as the EU plans to extend export restrictions? Thank you.
Thank you. We are in fact closely monitoring the development in Europe and elsewhere in the world, and we are also in a close discussion with our manufacturers and our suppliers. And we remain concerned about the supplies, continuity of supplies, and that is why we are encouraging Singaporeans to get vaccinated as soon as possible. But so far, we have not seen significant disruption. There was a disruption earlier on when we reported that I think Pfizer had to shut down their plant for upgrading, so we had a short-term disruption. They have already restarted their plant. The supplies have resumed. So far, the supplies have been on time, on schedule, but we remain concerned, and we will continue to monitor the situation. It is possible that even without intervention from Europe, EU, even logistics could be disrupted, shipment could be affected, and we do expect disruption from time to time. And today, our supplies are very tight. As soon as they arrive, once they clear the quarantine quality assessment, we put them almost straight to the vaccination center. So we have we keep very little stock, because we do want to roll them out as soon as possible, so that we can vaccinate Singaporeans and protect them as soon as possible. So we keep very little stock, and we want to roll out as much as possible. But that does also mean that at some point in time, if supplies are disrupted, we may need to also suspend our vaccination program until new supplies arrive. So I would like to seek Singaporeans' understanding that we are actually running a very tight supply situation, and we want to do it as soon as possible, as fast as possible. But that means that from time to time, we may need to disrupt our vaccination program while waiting for new supplies to arrive.
Thank you, Minister. Could we please have the next question from Financial Times?
Hello, good afternoon. I wanted to ask the panel about the Sinovac vaccines. Essentially, could you please tell us why Singapore received shipments of the Sinovac vaccine before the HSA's authorization for use, especially given for the other vaccines that Singapore did receive shipments arrived at least a week after HSA's authorization. Is part of the issue the fact that Singapore potentially was unable to turn down perhaps the Sinovac vaccine because it wanted to avoid potentially upsetting Beijing?
Well, ask DMS to provide some more greater detail, but essentially we have a supply contract with a supplier for Sinovac vaccine. And as part of the contract, the delivery was made to deliver, I think, 200,000 doses to Singapore. And we take the delivery, we allow the delivery to arrive, but we do not yet allow the vaccine to be used because we haven't approved the use. HSA hasn't approved the usage. And HSA continues to discuss with the supplier to get more detailed data to allow them to make adequate full assessment. So I think that's the situation. The key is because we do have a supply contract, and when the contract, under the contract, the delivery is made, so we take the delivery, but we do not allow it to be used for the time being, pending approval from HSA. And HSA is in the process of reviewing it, but they are still pending additional data from the supplier.
Just before DMS clarify, I just wanted to perhaps clarify the timeline that you talked about and the comparisons made with the other vaccines, because in fact it's not quite what you just described was not exactly accurate, because we made advanced purchases for all three even before any approvals were made. We said that, I think, late last year, right? Before approvals were made, there was a committee looking at the whole range of vaccines that were available, and we said that we were making advanced purchases in a way, in putting some bets in some vaccines, recognizing that some of these vaccines may not turn out to be effective, but we wanted to be able to do so early so that we would be relatively early in the queue and would be able to get some vaccines in for Singapore. So that was the basis in which we went about making these advanced purchases. It was only after the purchases were made that the companies started completing their trials, submitting data, and then they were then subject to HSA's approval. So that's actually the timeline and the process. And as far as the HSA timeline is concerned, or the HSA process, I think DMS can elaborate further.
Yeah, and also, just before DMS, the fact that we take delivery also allow us to roll it out faster once approval is given, rather than to have to wait for delivery again. So I think that's the reason why we also took delivery for the first lot.
Indeed, to extend the comments made by both co-chairs, we did make advanced purchasing agreements with these three vaccine manufacturers sometime last year. And this was, in fact, before the completion of all phase 3 studies associated with these vaccines, and before other regulatory authorities had given their approval for these vaccines. The advanced purchasing agreements included a timeline for when these vaccines will be provided, and based on that time frame, these vaccines would be delivered to Singapore by the manufacturers. In order to shorten the process by which approval would be done, and to allow vaccines then to be administered to the population, starting our vaccination campaign, the Health Sciences Authority designed a pandemic-specific approval framework that allowed for data to be submitted to the authority as it was available, there was no need to wait until all the data was in and to then submit that as one complete package, and they could submit this in tranches to allow for work to be done to start that evaluation process early. There's no compromise in the process of evaluation, but these little tweaks to the system allowed for evaluation to start early and then allow for the full process of assessment to be done before approval then is granted. And it so happened for both the Pfizer and Moderna vaccines that the data had been submitted in a timely fashion, and it allowed the Health Sciences Authority then to grant approval soon after or just before these vaccines arrived on our shores. And therefore, there's that perception then that the approval came and the vaccines then were delivered in short order. But in fact, this was based on a time frame that already had been planned for and committed to under the advanced purchasing agreements. With the Sinovac vaccine, the delivery of the vaccines, again, was based on the purchasing agreement. There was no coercion, there's no influence by other bodies, and this has been a commercial, contractual agreement with the manufacturers themselves. Unfortunately, in the data that had been submitted, and the manufacturer had endeavored to also to adhere to Health Sciences Authority's approval framework and try to give data in a timely fashion into the authority, they hadn't submitted a complete package of all the data that was necessary to complete that evaluation process. So the Health Sciences Authority has gone back, asked the manufacturer for more information, and in the meantime continues to evaluate and process the data that's been submitted to date. But until that additional data is submitted, the Health Sciences Authority will not be able to complete its evaluation process and therefore would not be able to give its provisional approval. And until that approval from the regulatory authority is obtained, we will not be using the Sinovac vaccine, even though it's arrived in our shores, because we want to assure all Singaporeans that the vaccines have been fully evaluated, deemed to be both effective and safe for use before we actually use it in our vaccination campaign.
Thank you. Could we have the next question from today, please?
Good evening, Ministers and DMS. My question is on whether we could get an update on the pilot for migrant workers to, relax their movement restrictions in the community. With the migrant workers being one of the groups that will be getting the vaccine soon, are there any plans to relax further the movement restrictions on them so that they can come out to the community more? Thank you.
We have been already progressively doing so. There were some measures that were done some weeks or months recently, and then the vaccination has just started for some of the migrant workers as well. So as we continue to get more of them vaccinated, and as we've always said, as we look at the infection rates and as we see things under control, yes, certainly the measures will be progressively eased and relaxed, and we will be able to announce and share more details and when the time comes.
Thank you. Could we have the next question from the new paper, please?
Hi, my question is about are there any updates on the nightlife establishments such as nightclubs and karaoke outlets opening, especially as there was a pilot program previously that required pre-event testing?
Yes, we had that pilot which we decided to put on hold earlier, because that was earlier this year, as we all know, when we had that rise in local cases, and we decided to put that on hold. At the same time, we had tightened up some of our local measures as well. We will continue to review that. We haven't decided to resume the pilot at this stage. As I said just now, we are taking a controlled process in resuming activities. Looking at the overall situation with our infection, with where the infection is, making sure it's under control. At the same time, looking at the overall progress in our vaccination plans. So we will continue to review that, and when we are ready and when we have more information, we will be able to share that with the nightlife industry as well as the media.
Thank you. Could we have the next question from Bloomberg, please?
Hello, good to see you all. I wanted to tag on with the question on migrants. We've seen cases there fall considerably, perhaps in line with the rest of the community. At the same time, as we've mentioned, you started the vaccination program there. I'm wondering why they are currently subjected to far more restrictive measures than the rest of the community, considering those factors. Thank you.
Well, we know that the circumstances in the dormitories, despite our safe management measures and despite our efforts to reduce density in the dormitories, which we have already done, remain places where one single case can easily spread to many other workers. It's not just the living environment, it's also the work environment where in construction, for example, despite our best efforts with having different zones and avoid intermingling of workers, it's very hard to really make sure that there is that kind of a segregation taking place all the time. So these are by nature higher risk activities at work and also a higher risk arrangement in the dormitories, despite all the efforts that have been put in place. And therefore, we are taking a more cautious approach, but some measures have already been eased, a lot more time for the workers to spend at the recreational centers. And as I said, progressively more easing will be coming very soon.
Thank you. Could we have the next question from ARD German, please?
Hi, there has been talk about travel bubbles between Singapore and Australia, and also yesterday about Bintan or Batam possibly. Can you comment on that, please?
We are in discussion with many places on the possibility of travel bubbles, so I can't give any specifics because these are all discussions that are still ongoing. But our basic approach is that so long as a place has managed to control the infection well and started to bring the infection under control, incidence rates are low, then we would certainly welcome talks with that particular country or place for a travel bubble on a mutual basis, allowing travelers on both sides. Because the incidence rates are low, as I highlighted just now, we really do not need to look at what kind of vaccines are being used, because overall, regardless of the types of vaccines, the country, through a whole range of measures, has been able to bring down the infection rate. So incidence rates are very low. On that basis, we will be prepared to talk on a mutual basis, on a bilateral basis, the possibilities of having a travel bubble. We had that possibility for Hong Kong that was deferred, but we are continuing the conversation with many other places which have been able to keep the infection under control, and as and when there are details, we will be able to we will share them when we are ready.
We will now take the last 3 questions. Can we get the next question from Channel 8, please?
Good evening, Ministers. Xuan here from Channel 8. Minister Wong, earlier you mentioned that travel without quarantine will be made possible before the end of this year should vaccination program goes well. So can we clarify on the definition? Do you mean when we reach a certain percentage of population being vaccinated, like 70 to 80% where we achieve the herd immunity? And second question on RGL. So the RGL with Germany, Malaysia, and Korea have been suspended since last month. So following the recent discussion between Singapore and Malaysia, particularly Malaysia, is there any update on restoring this kind of cross-border arrangement? And if yes, what is the prerequisite to restore it? Like the number of cases in Malaysia, maintain low level, back to 3 digits, or things like that. Thank you.
Thank you. The possibilities of travel without a stay-home notice when you come back is something that really hinges on, I think, not just the overall vaccination program, but also importantly our assessment, as I said just now, of what is the impact of vaccination in reducing transmission risk. We think there is some impact, and because of that benefit, we do believe that we can set out some new guidelines for vaccinated persons. Those new guidelines would relate to not only exemption from pre-event testing, but perhaps more flexibilities for interactions within our community, and importantly, potentially, which is something what I think many people are hoping to see, the possibility of reduced or even no stay-home notice when you travel abroad and come back. But as I said, we have not confirmed these yet. We are still working through them. And when we are ready, we will share what these guidelines are for vaccinated persons. On the reciprocal green lanes, these were developed before any country had vaccinations, right? So this reciprocal green lanes allowed people to travel without the stay-home notice, but subject to other protocols like a controlled itinerary and some testing. But then because when we all suffered that huge wave of the virus last year and early this year, we had to suspend these travel lanes. So we will look at the possibility of resuming some of the travel lanes, but with a different context, because vaccines are now available. And so the part of the discussions about about bilateral travel lanes would include now mutual recognition of vaccine certificates and what does it mean for vaccinated persons to travel. So we are looking at that as well.
Perhaps I can clarify further. The travel arrangements is likely to be quite varied among different countries. So we will start off with bilateral discussions, taking into account the situation here as well as the other country that we are discussing with, and we may have a bilateral agreement to ensure safe traveling between the two countries. And we may establish more such bilateral arrangements. And eventually, we may have more multilateral and regional arrangement. But we have to expect that each bilateral arrangement is likely to be quite varied, because you have to take into account the situation here, situation there, and they will be quite different. So we will not be able to have a standard framework for all countries. Eventually, after a year, 2 years, when almost all countries are able to bring the pandemic under control, have all been vaccinated or largely been vaccinated, and the situation are more homogeneous across the countries, then we may be able to have a multilateral global travel arrangement. But it's a long way off. So today, we still have to deal with the bilaterally in terms of travel arrangements, and that will be quite varied. And so it's difficult to answer a question, what level of vaccination would be comfortable for us. It really depends on from country to country.
Thank you. Could we have the next question from Ita Tas, please?
Good evening. Thank you. My question about Russian vaccine Sputnik. I know that Russian side already sent some offer to Singapore government about vaccine, and even there were information that there was some kind of consultation took place. Can you confirm that there was some kind of consultation? And is there any plan from Singapore government to purchase Russian vaccine? Thank you.
Thank you very much for your question. We have an expert panel that looks at a variety of different vaccines, both commercially available now, but also those that are still in development, with a view towards expanding our portfolio of vaccines to be used in our vaccination campaign. These would be either for use now or potentially in the future if there was such a situation where there might be a requirement for additional vaccinations, whether booster or otherwise. So the expert panel continues to look at all vaccines, and I understand they've been evaluating various vaccines. I'm not aware whether they've actually engaged in further discussions concerning the Russian vaccines, but I would not be surprised if they have had this on their radar as well. And they would make recommendations to the multi-ministry task force concerning the choices of vaccines that they think would be appropriate for Singapore to engage in procurement agreements, and then for a decision to be made whether to expand our portfolio of vaccines. At this point in time, they continue to be evaluating the vaccines, and we have no further information available to share with you about the next few vaccines that we might consider procuring.
Thank you. May we have the final question from Wan Pao, please?
Hi, good evening, ministers and DMS. My question would be, since vaccination for the migrant workers have commenced, is there a timeline for the vaccination of foreign domestic workers? And also, since we are allowing more employees to return to the workplace, will our public transport system and all the amenities and public spaces be ready to cope with this surge of people? Thank you.
So for the rest of Singapore, and this includes residents in Singapore, it's not just for Singaporeans, but when we talk about the age bands that we have highlighted, 45 to 59, everyone in Singapore, whether you are a resident, whether you are a Singaporean, will be eligible. So I think for the rest of the groups, we are proceeding based on these age bands, and they can come forward to be vaccinated accordingly. For the question on public transport, because of work resuming, we recognize that this is a concern, because as we allow for more people to resume work, we do not want to have a situation where there is congestion, particularly during the peak hours. And that's why I highlighted just now, when the tripartite partners met and discussed the possible easing of workplace measures, they emphasized also very strongly the need for employers to continue to put in place measures like staggered start times and flexible working hours. So we want to strongly encourage all employers to do so. The public sector will do its part in this regard, and we certainly hope private sector employers will also cooperate.